with the interactive quiz. So this will obviously need participation from in the chat, and I'll be talking to you about the answer and explaining why it was right or why it was wrong. Okay. So a patient presents headaches, dizziness, nausea, lack of coordination, and numbness around the body. Here is the picture of their MRI scan. What could be a potential diagnosis? So here's the MRI scan. I would focus on this part here. So I just need, so from all the seminars we've had about um, our neurosurgery, like the types of things that can happen, try and think about what it might be. So could it be a brain bleed, a hemorrhage, oh, they're the same thing, or like a tumor, what could it be? So I'll give you about 30 seconds. Okay, we have had a couple answers in the chat. We would need more interaction, please, because this is an interactive quiz. But yeah, it's actually none of them. It's a cerebral edema, which basically means swelling of the brain. So this could have been caused by traumatic brain injury, and some medications that neurosurgeons and physicians would look for are diuretics to reduce fluid retention, corticosteroids, which is a type of medication to decrease inflammation in the body, and medications to kind of control seizures because these cerebral edemas, obviously, they're taking up a lot of brain space. Where the brain was originally. So all that pressure is being applied, and this can cause seizures and intracranial pressure rise. So you would know what intracranial pressure means if you have attended previous seminars, but if you don't, it just means a lot of pressure inside the brain. So inside the brain cavity, when there's a lot of pressure, it's just named intracranial pressure. Then we have osmotherapy. So this is where you use hyperosmolar agents like mannitol. And basically what that means is like it's kind of like hypertonic saline, and it's used to draw out fluid of the brain. So if you're doing A levels, A-level biology specifically, then you would know that hypertonic kind of means where the inside of the cell has a higher water potential than the outside of the cell. So the water kind of draws out of the cell, and that's what causes it to kind of shrink in size. So that would be really helpful for something like a cerebral edema because it can help reduce the amount of water that's inside the cells. Then surgical intervention could also be used in severe cases, such as like surgical, so as I said, it can help to release pressure or remove fluid. And it can also be used for management of underlying causes and addressing the root cause of edema. Um, is crucial for effective treatment because all of these treatments are there for different sorts of situations of when a patient may have a cerebral edema. Maybe the patient doesn't have the capacity to kind of undergo a surgical intervention, so they would be kind of limited to the diuretics and osmotherapy. But if they can and they don't really have any comorbidities, that means like any other health conditions, and they're fit enough to actually go and kind of survive the surgery, then the surgical intervention would be a better choice, especially if the cerebral edema is quite impactful. All right. Another question. One patient's CT scan indicates a brain bleed. What type of brain bleed is this? So the brain bleed that I'm referring to is this, the red line right here. So anything out of that red line here, so that's the brain bleed. So here are the options. A, intraventricular hemorrhage, B, subarachnoid hemorrhage, C, subdural hemorrhage, and D is epidural bleed. So yeah, just again, if you don't know, hemorrhage and kind of bleed just means the same thing. It's just hemorrhage is like a more medical term. So don't be confused by what hemorrhage and bleed means. They're the same thing, but these are just different, the names. So yeah, 30 seconds-ish.
इंटरवेंट्रिकुलर वेंट्रिकल के अंदर हो ना तो ये फाइन ठीक है हेलो
Okay, so we've had a couple of B's, and it's actually not B, it is C. So subarachnoid hemorrhage. So here I have like a little diagram that we used in our previous seminars. Subarachnoid hemorrhage is basically this part. So it happens between the the dura mater and the subarachnoid space, hence the name subarachnoid. But the actual answer here is subdural bleed. So why is it subdural bleed? Because this purple lining, I'm not sure if you can see, but this purple lining is the dura mater, and then inside the space, so where the blood is filled, it's the arachnoid space. So between these two parts, it's called this is known as the subdural region, but here this is known as the subarachnoid region. An interventricular hemorrhage is basically when there are parts of your brain where they're known as ventricles, and they are there to actually kind of I guess for the movement of CSF. So CSF is cerebrospinal fluid. Um, and so that's what the ventricles are for. And so intraventricular means that there is brain bleed around in that area. So that would be around here. So if you go back to the CT scan, it would show like white space around here. So that's the intraventricular. But here, this part is fine. This part is dark. So it's not here. It's actually happening here, which is indicated by um, this part. So I hope that makes sense. And so yeah, epidural bleed happens between the skull and the dura mater. So it's around here. So it doesn't happen inside the brain. It happens just at the top of the skull cavity. All right, next question. A patient has experienced a brain hemorrhage due to a car accident. What is the order of treatments that should be provided? So here you should try and read each of the question, choices and pick the best one that will be the most suitable. So A is surgical drainage, diagnosis, medications, rehab. B is diagnosis, monitoring, rehab, surgical drainage, and then medications. or C, diagnosis, medications, surgical training, and rehabilitation. I spelled rehabilitation wrong there, but yeah. So yeah, 30 seconds. I will give you less than that because it shouldn't take that long. Okay, so we've had C, which is correct. So here it was quite, I guess, easy in a sense. You just needed to read which one would be the most suitable. So yeah, now we'll move on to this question. Again, if you have any questions, please do ask them in the chat. I'll be happy to answer them because let's say you didn't attend these seminars, you would be a bit confused about what this is. So I'm glad that you're trying. So if you like have any questions based on the content, please do ask. So yeah, this question, a patient has been diagnosed with a subarachnoid hemorrhage, which we just went over, after a distinctive thunderclap headache. What is a subarachnoid hemorrhage caused by? Aneurysms, B, traumatic brain disorder, injury, C, smoking, D, atriovenous malformations, C, uh, sorry, E, lack of exercise, F, alcohol, or G, high blood pressure. So this answer has multiple answers. So yeah, do with that as you will. 30 seconds. Okay, so we've had all sorts of answers. We've had ABD, um, yeah, AG, ABDG. So it's actually all of them. This was a trick question, but yeah, Leah is correct in saying that ABD are like, I guess, the most prevalent um, you know, causes, but the other ones are also, they kind of are also like causes of um, a subarachnoid hemorrhage. Okay, let's go on to the next question. Don't know why this isn't working. I'm so sorry, my mic was off. So these are really, really important to explore ethical scenarios because of the fact that interviews, especially university interviews and MMI interviews especially, they do ask you a lot of these type of questions. They won't specifically ask you about neurosurgery in general, but they will ask you like relevant questions. So the things that you will talk about in your answers for these questions, you could also apply to the questions they might ask you in MMI interviews. So it's very important that you kind of think of these questions and also interact with these questions to kind of prepare you and just help you with some practice. So yeah, these will also have a lot of like ethical lessons that you may not be familiar with, like ethical principles. So if that is the case, then I'll try my best to kind of explain to you what each one of them means, so then you can get like an idea of what they actually mean. So now onto the question. As robotic assistance becomes more autonomous, the manual dexterity of incoming neurosurgeons has started to change. The robotic system has started to consistently have lower tremor rates. So tremor basically means like movement of the hand, because obviously it's a robot, it doesn't really have that. It has a higher accuracy than a human hand. So the ethical question that I want you to consider is if a robotic system is statistically safer than a human, is it unethical to allow a human to operate on the patient? So I'll give you about like a minute because this is a more deeper question. So yeah, please do put your answers in the chat and we'll discuss what you could have said or if your answer was what the examiner would be looking for. Just while people are writing the answers, I can go over a little bit of what you could include without giving away the answer. So you could talk about how the word autonomous is used. So autonomous means that it kind of has its own choice, and it can do. the things with its own brain. So like the robot has its own autonomy, and its manual dexterity is increasing, which means that it is, I guess, more effective um, than compared to a neurosurgeon. But also, you could consider the fact that neurosurgeons are very, very highly trained individuals, and they have a lot more experience and they've seen a lot more patients. And they're, I guess, trained in a better way and longer than robots would be. Uh, but those are some things that you could consider. And is it really ethical to kind of put a human patient underneath a robot entirely on its own? What do you think about that? Okay, we're getting a couple answers. So, one person said it depends on the situation, but I think humans are more reliable. And the other person, Leah, said it could be unethical because one of the duties of a surgeon is to choose the safest option for the patient to prevent causing harm according to non-maleficence, which is one of the ethical pillars of medicine. However, humans are still needed to for the judgment side when there are complications, as statistics aren't always 100% accurate or applicable to every patient. Overall, I would say that it's more ethical to allow a robotic system to operate if it has better dexterity compared to human surgeons. Okay, all fair points. Now let's move on to the next question. I'm not too sure on the ethical principles that I would apply, but I believe that on allowing a human to operate is not unethical because the robotic system could potentially function at any given time, especially if it's autonomous, as it has a lack of sensitivity and humanity. It might not be able to detect or see things that a human will. Human surgeons are very well skilled with their training. They may be more reliable and less likely to make mistakes. Both operating with robotic systems and humans have their own pros and cons. So yeah, all of these are very, very fair ideas. And yeah, it's completely fine if you don't know what the ethics are yet. So again, so you could talk about over reliance on robots. And we've seen the kind of effects that robotics and AI are currently having on the world right now, especially on the environment. So yeah, you need to kind of consider the best interest of patients because that is what medicine and that is what the ethical principles of NHS are really about. They really, really focus and hone in on the fact that you need to do anything that you do needs to be in the best interest of the patient. So it kind of entirely depends on the situation that the patient is in. Um, you could also talk about the fact that, um, maybe the patient is severely like in need of surgery and they don't really have time to kind of set up the robot. So obviously then it doesn't matter if the robots have a statistically higher like lower tremor rate. They need medical intervention now, and that is when a human hand would be the most reliable and safest choice for the patient. So again, it depends on the situation. You can also talk about authenticity of care. So this is something that people have actually talked about, in terms of like saying that robots don't really have the sensitivity and the human element that a human surgeon would. So yeah, these are all correct and fair points. So yeah, let's move on to the next one. A A robotic powered system is used during surgery. The robotic system starts malfunctioning whilst carrying out the procedure. The ethical question is, whilst robotic assisted surgeries have many benefits, including reduced recovery times and increased precision, do those benefits outweigh the risks introduced if the robot breaks down? So I'll give you like a minute. We're kind of running out of time because the guest speaker needs to come in about 4 or 5 minutes. So I guess these will be one of the last questions. Again, this question is quite similar to what we've had previously, in the sense that one of the people actually that answered the question touched on the fact that if it starts malfunctioning, whose responsibility would it be? But yeah, you could definitely talk about a lot of different things, such as, I don't want to give it away, but yeah, I won't say what you could talk about. Okay, answers are coming in. I think that these benefits could outweigh the risks as there should be highly skilled and trained surgeons, professionals supervising the robot. So when a malfunction does occur, they can intervene to ensure patient safety. Additionally, it should have been made clear to the patients the risks that come with using the use of robots, allowing those competent patients to I think you mean like capacity, like the patients that have capacity to decide if they would like to be operated on by the robot with its risks and advantages of a quicker recovery. So yeah, fair point. This is dependent on statistics because human surgeons may also cause further damage during operation as they are also human after all. Yeah, exactly. I believe that it is important to compare statistics in this case, which I'm not certain of. Um, if the robot malfunctions, the doctor medical team will have to take responsibility of the mistakes made, same way as if human surgeons may also would operate, they would take responsibility. I believe it's important to think of robotic systems as tools to assist in the enhancement of modern surgery, but not as a separate entity that is making decisions. The medical team will be responsible for the outcomes of the surgery. Therefore, I believe that the robotic assisted surgeries benefits do outweigh the risks. Amazing points, by the way. So yeah, what the second answer was referring to was the ethical principle of duty of candor, which rightly put by Adelina is basically what it means by saying like, let's say you make a mistake and it has negatively affected the health of the patient, then you must tell them the truth and be honest about what caused the mistake and what you're going to do about the mistake. Because obviously we have as medics we have the responsibility to take care of the patient, but if something goes wrong we need to be very very clear and honest about what went wrong. So yeah, exactly. And pillar of non-maleficence as well, so that means that you're gonna do your whole entire best to make sure that there's no negative impact caused by what you do to the patient, which means non-maleficence. So yeah, these are great points, and you guys actually went into greater depth than needed, which is amazing. And I also really like the structure that you guys are putting your interview like in the answers in, because you kind of go over both points. So yeah, that is great. Now I'm gonna hand over to Cameron, who is our guest speaker for today. These are all the questions we're meant to do, but obviously it took much longer, so it's okay. So yeah, if I can hand over to Camron now.
First of all, hi everyone. I hope you're all doing well. Thank you to Serena and the rest of the Aspiring Surgeons Network for having me today. So today I'm just going to be speaking about my journey to dental school. I'm going to talk to you guys about, the stuff I went through because I'm only second year right now, so I'm 20, so I'm only a couple years older than you guys, so I would have faced kind of similar struggles and things like that. And then I'll be sharing some advice on how I got in as well. So, Serena, when I say next, if you could just go to the next slide, that would be great. Next. So I'm gonna go over a bit of an introduction. So my name's Cameron. I'm a second year, like I said. I'm gonna be providing mainly tips and advice on the different steps and different hurdles I had to face when I was at applying to dental school. Similar to, all of you probably applying to medicine or dentistry or something in, the healthcare field, I'm assuming. Um, if anyone does have any advice or questions or wants any, UCAT interview tuition, anything of the such, you can just contact my Instagram. It's at Dental Dhillon. Or you could just type up my LinkedIn. It's literally just my name, Cameron Dhillon, and then we can have some time for questions at the end. Next. So I like to, whenever I talk about, my journey to dental school, how I got in, I like to split it up into 6 stages. So these are the 6 hurdles I had to face. So these are the main ones. So GCSEs, predicted grades, UCAT, personal statement, interviews, and then your actual A-level grades. So I'm going to go over each of these 6 stages in depth, and hopefully you guys can take something from this. So next. So first of all, GCSEs. First point I like to make is they do matter more than you think. So I know a lot of you watching this are probably year 11, year 12, year 13. Now it's not the be all or end all. So if you don't have great GCSEs, it's not like you don't apply, don't try to apply. You can still apply, but if you are still doing your GCSEs, definitely take them as seriously as possible because I promise you they do matter more than you think, because GCSEs are your kind of one of your only national kind of like registered results. So rather than like a predicted from your teacher, this is actually done by examiners and then it's gone through multiple like processes of um like filtering just to make sure this is like a genuine result. So definitely don't overlook GCSEs. Take them as seriously as possible. You kind of need typically high grades in, math, sciences, the kind of dentistry related fields. Um, and if you haven't done so well, don't worry about it. It's okay. There's still a lot, like 5 more other stages, you can excel at. But I would say some universities do look at GCSEs more than others. So try to apply strategically. So have a look at what the university wants. Have a look at typically what they look for. So some place a big emphasis on the UCAT, some place a big emphasis on your personal statement, and some on GCSEs. So if your GCSEs, of course, aren't that great, pick the other universities that look at different things. Next. So predicted grades. Now, I would say for this one, my first tip is make sure you do as well as possible in all of your year 12 exams. So I know that you guys probably have mocks coming up, or if you're year 12, you have mocks coming up. Of course, if you're year 11, you're probably going to be soon to do your GCSEs and then you'll have exams and stuff in year 12. But make sure every single test you do, not even just the small class tests, make sure you know what you're doing and make sure you try and score as high as possible on them. Because let's say, for example, something happens and you have like a mind blank mid-exam in your mock and you end up getting a really bad score. Your teacher is going to have to look at your other results if you're trying to explain to them why you need this A or A star, right? Because although they say the mocks kind of determine your predicted grades, your other grades from school and from your class, they still are accounted for in the predicted grade like judgment. Also, I would say most unis, they kind of just, because of course how due to how competitive dentistry is, most unis literally just reject you straight off of the predicted grades if they're too low. Like for example, if you have BCCs, your predicted grades, and you try to apply to dentistry, they won't even have a look at your personal statement. They'll just reject you straight off the bat. So make sure, because this is a factor that rejects a lot of dental students or applying dental students every year, make sure um, you get them as high as possible now so you don't get shut down for any of the other factors, because you can have an amazing UCAT score, a really good personal statement, and your speaking and communication skills could be superb. But if those predicted grades aren't up to scratch, they'll reject you straight away. And I would say ensure you build a good rapport with all of your teachers or subject leads, or just the people that determine your predicted grades for each subject, as they're going to be the people that are going to be looking at, how well they think you can do. So, for example, with biology, for example, so I got an A, I think, in the biology test. I think they just had given us a really awkward biology test. But because my teacher, I had built quite a good rapport with her. She knew I was enthusiastic about the subject. She knew that in all of my other tests I had done, I had got consistent A stars. She decided to predict me an A star, even though my mock had said an A on it. So that just goes to show if you are able to build a good rapport relationship with your teachers and show you're enthusiastic about the subject and show you want to learn, your teachers will use that and they'll use that to reflect on what you can do, on your capability, on your potential to get that grade in the future. Okay, next. So my next obstacle or hurdle is the UCAT. Now, this one I would say, even for me, was probably my worst exam just because of how different the skills were that you're kind of used to. They're not like GCSEs or A levels at all. Typically people buy Medify or MedEntry. So I primarily used Medify. I bought both, but I bought MedEntry at the end just to use the mini mocks, I think. But I preferred Medify personally. There are people that say different things. There's people that prefer Medify, there's people that prefer MedEntry. But yeah, I just used Medify. I mean, but it definitely out of those two, use one of those two for your UCAT prep because they're the main ones. For UCAT, consistency is key. So I think when I was in year 12, I had my mock in around, I think it was end of April. And then I started my UCAT revision like mid-May or something. So I only gave it about 2 weeks. But the UCAT revision I was doing, it wasn't a lot. Maybe it was a few verbal reasoning questions a day or a few quantitative reasoning a day. It wasn't a lot of questions, but because I was consistently working, it added up over a while. So definitely for UCAT, consistency is key, especially because of how different this exam is. I would say here also try to book for summer specifically. So when the bookings come out for UCAT, they get taken up really, really, really fast. So I think I'd say I was one of the first people to actually book my exam for UCAT. But they get taken up really fast. So the worst thing you'd want, well, at least in my case, would be to have it in September when there's school time, because of course you're thinking about, your year 13 work, and then on top of that, you're doing very heavy UCAT practice because of course your exam is coming up, right? So I booked mine for around end of August because I knew there was nothing else I had going on then. So I can literally just solely focus on UCAT, get that done, get out the way, and then I can move on to kind of my next obstacle. So make sure you book early, guys, is what I'm saying. With UCAT, like I said, it's a different type of exam. So this one is more dependent on kind of like your cognitive ability and skills, as opposed to, how well you can memorize something or how well you can like memorize a mark scheme or understand how the exam is like questions are written or something like that. It's a lot different than you'd think. So what I would say is don't cram 2 weeks before the exam because it won't work. I would say definitely try to do so start by doing just questions a day, like, I don't know, maybe 100 questions in a day or 50 questions in a day, and slowly build up to it. Because also what you don't want to do is you don't want to just do, let's say, I don't know, 200 to 300 questions a day and then get burnt out. And by the time you kind of peak, it's like too early. So then you end up kind of declining in ability for the UCAT, and then you're not scoring as well as you want in the actual exam. So you want to peak when you sit your actual exam, basically. So yeah, make sure to do consistent practice, build up your practice. And then they also have stuff like mini mocks, which is like basically because the UCAT it's split up into different sections that are all timed. I'm sure a lot of you probably have read about this or know about this, but on Medify and MedEntry they do this really good thing where they do mini mocks, which is like they'll give you one section. So where you'd have, I don't know, I'm not too sure how long it was, maybe 30 minutes to do the decision making. They'd give you that time, but just for the decision making, which I arguably found was better than sitting an entire mock at once. So make use of the mini mocks as well. And finally, get used to the keyboard controls and number pad rather than clicking on the screen. With UCAT, I would say my main tip is timing is key as well. You barely get any time to answer the question. So all of the time you basically are looking at that screen, it needs to be brain power on that question. So I would say getting used to the control. So for example, I think Command N or Control N was next in the on the screen. So instead of moving my mouse to click next, I could just click that on the keyboard. It would be way faster. And also with the quantitative reasoning one, they give you an on-screen calculator. I highly do not recommend using that with a mouse because it makes your work so much slower, to the point where you can't even understand the question because you've used up so much time trying to type the numbers in. So always use the keypad and always use the kind of control or command functions on your keyboard. Next. Okay, so after the UCAT, I then sat my personal statement. So, or I did my personal statement. So, what I would say for this is get as much work experience from as many different kind of dental practices or dental related things as possible, just because the more exposure you get, the more experiences you have. Now, this leads on to my second point. This is probably the most important point in the entire, just with personal statements and interviews. So if you're going to take one thing away, definitely take this away. It's what you take from the work experience, not the fact you've done it. I can say to someone, I've done 6 weeks at a dental practice, I've shadowed 6 weeks, but if I have nothing to tell them, if I have nothing to say, what I'm saying is completely useless, basically. So you need to understand that it's what you take from your experiences, it's what you've learned from them, what communication skills you've learned from them. For example, I remember one time it was about my dentist. When I was shadowing my dentist back in work experience, um, he basically, there was a patient that was really, really scared of getting his teeth cleaned. And he essentially kind of used the kind of like drill, the slow speed drill on his hand, on the patient's hand, to kind of get him used to the sensation of what it would feel like. And then after that, very slowly, the person started inching into the chair. And then he was actually able to get a lot of calculus or plaque off of his teeth, which was really good. So stuff like that is what you kind of want to include in your personal statement, not the fact you've done it before, right? With personal statements, be clear. Don't use advanced terminology to try and stand out. Now, as much as you guys might want to kind of use these advanced words and subject-specific words to kind of make yourself stand out and show your passion and stuff, I understand that, but a lot of the time it doesn't really come across as that, just because if you don't if you don't completely know what you're talking about, some of the words may not make sense, like in terms of what the actual examiner is reading when they're reading your personal statement. So just try and be as clear as possible. I wasn't that technical when I did my personal statement, and I still got through to the next round. So honestly, they just care about clarity. You want to be clear with what you're saying. You want to be clear about your experiences, your reason as to doing dentistry, etc. You don't need to use heavily advanced words. And finally, don't be generic. So I'm sure you've probably heard this from some people at school, or like one of your subject leads at school, the person that does the applications. But you need to think, for dentistry and medicine specifically, they are highly, highly competitive fields. They get a lot of applicants coming in every single year. You need to be very authentic with what you're saying, what your reason for dentistry is, why you want to choose it as a subject. You saying it's because, I don't know, I had my parent had a fitting, and then after that I really wanted to do it. One, that's not detailed enough, and two, that 90% of students will probably be saying that. So you need to make sure your reason to do dentistry is clear. It links to the different skills used in dentistry, and is authentic to you. They don't want to just see like a fake reason off of nothing, because they can spot that really easily. Remember, these people have viewed thousands of personal statements in their time. So if you provide a fake reason, the examiner will know straight away. Next. Now, interviews. So for me, arguably, in my opinion, this is the most important part of the whole application process. So this is the time where they actually get to see you face to face, and they actually get like a real first impression of what you're like. Now, the interviewer only sees you for 20 to 30 minutes. You need to make sure this 20 or 30 minutes counts as much as possible. You need to give the best impression you can off to the interviewer, right? So come in with enthusiasm, come in with like some energy to you, and make sure what you're saying is valid. Make sure you've revised what you're saying. You've well prepared for this, basically. Don't think of this as like I'm going to have like a very casual conversation with the interviewer. Although it may seem like that, although the interviewer will try and kind of play it off like it is casual, don't be nervous, of course, but make sure you take it with the utmost seriousness, because every word you're saying is contributing to the impression you're giving to the interviewer, which would then ultimately depend on whether you get the offer. I would say non-verbal communication is equally just as good as verbal communication. So if I'm talking like this, and then like, if I'm talking like that, that doesn't really give off an impression that I want to do the subject, that I want to do dentistry, or I want to do medicine. If I'm talking with hand gestures, I'm speaking like I'm enthusiastic, and I'm speaking with energy. Already the interviewer can see kind of how passionate I am about the like career, how much I want to do the career. And they also like, you strike them as a person that, like, you know, that cares, that wants this opportunity, that appreciates this opportunity. So you look better in their eyes, basically. So definitely try to, which is the goal, of course. So definitely try to use as much kind of non-verbal communication as well as verbal communication. And my last thing I would say, read up on hot topics on like in dentistry. So for example, I know amalgam is getting banned very soon. So that would be like another hot topic. Whereas when I was doing it, it was more so a debate as to whether amalgam or composite was better and the kind of arguments for and against them. So read up on hot topics in dentistry. That's definitely what I would say. And also, because a lot of students do miss this, research that specific university you're applying for, because it also applies to medicine as well, but research the university you're applying for. Don't give a generic answer like, I don't know, I love the societies, I think it's very diverse, I really like the nightlife. Talk about a specific society in your that university you're looking at. So for example, when I was doing my interview at King's, I talked about, I think it was the Smile Society. They go to like primary schools, they help children out by teaching them about oral health and oral hygiene. And I thought that was a really nice experience. So that's one specific thing to the university you're quite fond about. So that, and also like different services the university provides. So different technologies, different opportunities the university provides. Essentially, research that specific university in and out before you go into your interview. Next. Now, your final step, final hurdle, your actual A-level grades. So once you've done all of these steps, these 5 things have been done, your last thing you need to do, they've given you the offer, they've given you the grades, which is typically A star AA, but it can be triple A as well. Um, don't don't slow down, basically. Don't ever think, or don't ever be complacent or get complacent and think, okay, that's fine, I got my offer, I'm going to be fine. Because unless they send you that email saying congratulations, you're in the uni, you can get literally rejected at any point. I've seen it happen, and it's really not nice when someone's put so much effort in just to fail at the last step. So if you've got that far already, do not slow down, carry on with your continued revision. I'd say ensure continued revision and also practice past papers until you're sick of them. And I seriously mean sick of them. When I was in year 13, I think I did, let's say, I don't know, for chemistry, I think I did every single paper 1, 2, and 3 like 3 times over, but like in intervals, of course. This was over the space of 4 or 5 months. But basically, it got to a point where I was doing around 5 or 6 papers a day. You don't have to do that much to that extreme amount, but what I'm saying is, even if it's just 3 papers a day, come your like revision time, I promise you it will pay off, because at that point you've understood the mark scheme, you've understood all of the questions they can ask you, and like things that they can do to throw you off, and basically you can't be caught out. And yeah, final point, don't let your guard down at any point, because until you're in the uni, you can get rejected at any time. Next. So that was basically a bit about my journey to dental school. That's what I had done. That's a few tips and advice I have to share with you guys. Does anybody have any questions? What other things have you done to show your passion? Um, So in terms of stuff that I did to show my passion, so with dentistry, I had done so work experience was one thing, so that's like my extracurricular stuff, but also like the skills I had obtained. So for example, I used to volunteer at like a care home, so that would help with my communication skills, especially with the elderly. I also used to, in summer, I used to do stuff to do like a library program. So what would happen is, I think it's like a summer reading challenge. So I'd also be able to speak to children as well. So kind of, I'll be able to speak to different demographics of people. And due to that, I can kind of build my communication overall. So that's another thing I've done. Um, and then why did Kings appeal to you? Well, I would say, it's like a collection of things. So one, I had quite a good UCAT score. So mine is on the old spec. So I had 2830 band 1. My predicted grades were 3 A stars and an A. And then in my personal statement, I had included a lot of stuff about my work experience and experiences I had in general. Um, like in the work experience and outside of the work experience that had contributed towards skills in dentistry. And then in the interview, I tried to answer questions in full. So I tried to answer them as well as possible, as full as possible. I think roughly for Kings, let's say, they asked, like it took like 5 minutes, let's say, to answer a question. I'd make sure during that 5 minutes, the majority was used saying important stuff. So it was only until, the last 30 seconds where I kind of went a bit more silent because I had said everything I need to say. So that's typically why Kings appeal to me. And how do you find the dentistry course? For me, dentistry course is really good. I really like it. It's really social based. The cohort's really nice. I like spending time with people. It's really tight knit as well. So through dentistry, I've been able to meet people from Leeds, Manchester, Birmingham, Newcastle, loads of different places. So it's really good. Do I think doing four A levels matter? Um, well, I just did four. So with me, I took biology, chemistry, maths, and further maths. The further maths you didn't actually need. I just did it out of interest. But the biochem and maths, you of course, I picked because of dentistry. It doesn't really matter, I'll be honest. Even if I'd got a D in further maths, it wouldn't have mattered. So they don't take into account that. There's countless people that have got in with biology, chemistry, maths, or even just three A levels in general. And does Kings do MMI or panel? So when I did it, it was panel, but I'm not too sure if it's changed now because my application process was a couple of years ago. Is maths necessary for dentistry? No, no, it's not. So I get this question quite a lot as well. Biology and chemistry, I would say are necessary. I think actually you just have to sit one of them. But as a second year, I can tell you for a fact, biology and chemistry are both necessary for dentistry. There's heavy amounts of biology in dentistry, by the way. A little bit of chemistry, but mainly biology. So I'd say save yourself the stress of having to learn it like properly like for the first time and pick biology if you're doing your A levels if you're picking your A levels, sorry. If you're doing them, um biology I would say is a big part of it and chemistry is. Maths not really. It just needs to be a science. So people have got in with biology, chemistry, psychology, for example. So no, it's not necessary. I think KCL does MMI. Okay, fair enough. When I did it, I think it was panel, but that was just because it was near kind of lockdown time. It was just opening up. So of course mine was online. I'm not too sure if they're doing it in person now or they're still doing it online. But yeah. And if anyone does have any further questions at all, please just message my Instagram account. It's just Dental Dhillon. So I'm open to respond to anyone for advice. How many weeks did I revise for the UCAT? Well, I mean, it differs for everyone, but I would say around 6 to 10 weeks is like the kind of sweet spot. Some people, of course, are faster learners. They could do it in 6 weeks. Some people take a bit longer, 10 weeks. But I'd say around May to June time is when you want to start revising if your exam is, for example, in August. So maybe take around 8 weeks to revise. And I did it in late summer, so it was at the end of August. That's when I did my UCAT, just before school started, though.
All right, I think those are all the questions we have
Yeah, that's
so
fine.
far. Yeah, so thank you so much, Cameron. This was very, very helpful.
No worries, my
Just
pleasure.
yeah, just one question that I have for you is
Go ahead.
what did you get for your actual A levels, just to put in things into perspective?
Okay, I'll tell you now, it's not this isn't the case. You don't have to do this. I got four A stars. You don't have to get four A stars. An A star AA would have sufficed for Kings, but I think I just ended up getting into a tunnel if I wanted to get the A star. So I just kept revising and revising and revising. And then yeah, eventually I ended up with four A stars in my A levels.
So what was your offer grades?
Offer grades, A star AA. So that was my
Mm-hmm.
offer grade from Kings, and then Queen's also A star AA.
So
Yeah.
what unis did you apply to? King's,
So
Queen.
Kings, Queens, Plymouth, and Cardiff. Plymouth, I didn't
Mm-hmm.
get in. I didn't get in after the interview. Cardiff, I got rejected post-interview, pre-interview, sorry. So it does happen, but I'm telling you guys, don't take these rejections to heart. Um, Even if one uni accepts you, that's still perfectly fine. Kings and Queens both gave me offers, but I chose Kings just because I liked being next to the Shard. And it still is nice. Was KCL your firm uni choice? Yeah, I firmed KCL. And then I just had Queens as a backup, but both had a A star AA, so it was the same.
All right, thank you very much, Cameron. I'll send
No
you a
worries.
feedback form thing that you could fill out.
Yep.
But for the people that attended the seminar, could you please fill out the attendance form for the certificate? Once you've, done attended 5 of our seminars, we'll give you a certificate. But yeah, if you have any more questions, I'm sure Cameron will stay behind for a little bit to answer them face to face if you want. But yeah, I think that's all we have for you today.